I am one of 6 children. It is 3 boys and 3 girls. I was born and raised in South Texas, right on the border. So Monday through Friday, go to school. On the weekends, go to Matamoros, which is the Mexican side, on the Mexican side. I grew up with working class parents. I'm the first one in my family to not only go to college, but also go into medicine.
I'm from North New Jersey. I am Dominican and African American. I am the first doctor in my family. And yeah, no, I'm grateful to have studied medicine in Cuba.
I was born in a small campo in the Dominican Republic called Los Palmaritos. And basically my family were farmers. Nobody in my family ever received formal education beyond a primary school level until we were given the opportunity to go to the United States, and then I was the first person to graduate college, and now I'm the first person in my family to become a doctor.
I grew up in Guatemala and I immigrated in the U.S. in 2006 as an immigrant, and I was in 12-year in foster care system, and then none of my family is a doctor, none of them.
I'm the first doctor in the family. So I grew up in Los Angeles area between the houses of my grandparents that came from Mexico. My mom was pregnant with me when they came to the U.S. from Mexico. I was born in California. And growing up, like I said, with my grandparents, with my cousins, there was up to 15 people in one house at the same time. So we didn't have the same access to medical care as other people, which is part of the reason why I wanted to become a doctor and serve those communities that I grew up in.
It was really the values and the examples that my parents gave me. They said, your profession is not just how you make money. You have to understand that you're part of a community and you play a role, and you can't just take. Because at the end of the day, the better your neighbor to your left and the better your neighbor to your right is, the better your community is. So you have to understand that when you choose a job, you have to find something that not only you're passionate about, but that you keep true to your values. And in addition to that, my mother, who is an immigrant, always told me that we live in a country of opportunity. So she never said you have to do this, but she said, take advantage of the opportunities and serve. And not only did they tell me that, but they laid the example. So many family members we helped when they crossed the border, so many extended family members we helped in our house, we housed them. So I saw that my parents really they didn't give up what was left over. They sometimes even took some of the stuff that we had and gave to our family members. So they gave me that example. They didn't just say, this is how you ought to live, but they gave me that example, and they sat down and they told me what their values are and said, and one day you'll have to figure out what those are for you.
Well, I think it's very important that citizens or non-citizens, they receive health care. It shouldn't be a privilege, it should be a priority. That was one of the main reasons why I decided to study here, and it was a new environment. It was an opportunity to learn Spanish. I'm half Hispanic and I didn't know Spanish before this, and now I speak fluently.
I was very drawn to the fact that ELAM focused not only on the scientific side of medicine, but also the social and political and economic side of medicine. It's a school that emphasizes viewing the entire human being when you encounter a patient. And even beyond that, viewing patients as part of a community, and also has a dimension of social justice as well. So with that's something that really drew me to the program, because I was doing community organizing at the time, and I was looking for a way to bridge what I saw as my two passions, which is medicine and health in general, and fighting for justice.
My mom, she inspired me to study medicine because I have like a dream. I want to go back, other than helping in the U.S., of course, I want to go back in Guatemala too and help my people. And as far as I know, here in Cuba, they have like the best clinical knowledge, and I do need the clinical part that I must study.
I was applying to U.S. medical school programs, and this application was actually due a couple months after the other application, so I was in the process of interviews. And someone mentioned that they had been attended by a Cuban doctor, and they said they're really, Cuban trains the best doctors, and I got interested little by little. And I chose to research the program. The more I heard about it, the more it sounded like something I wanted to do. And through that application process, it happened very fast, and before I knew it, I was on my way here to Cuba.
I did not know much about Cuba. It was kind of funny because growing up, and I tell folks and they laugh, I always knew like, oh, Cuba, bad. But they have good doctors. Even my family members who had only gone to middle school, they're always like, Cuba, oh yeah, bad. Hey, but they have good doctors. And when I was in college at the University of Iowa, there was someone who was part of IFCO since its earliest days, Peggy Valdez, and she actually told me about the program. She didn't force it on me, she said, consider this. I know that you've heard this about Cuba, but look at these videos. And it was about a lot of the ELAM graduates, not just from the US, but from Latin America, from Africa, and the wonderful work that they were doing, and the type of medicine that they practice. Not only did they train it, but practice in their own countries against a lot of odds. And it inspired me, and it really challenged the notions of what I thought to be true. And that's when I started applying. Obviously, my mother was like, Cuba, ah! But she said, but I hear they have good doctors, so it was funny. And so I applied. Thankfully, I was given the opportunity, and now we're here.
My experience has been just that, an experience. There were good times, there were bad times. There were some moments where I thought the bad outweighed the good, but at the end, I achieved the goal that I wanted. I stuck with the program. I stuck with it when it got hard, and yeah, I'm just grateful to have made it this far.
It's been a roller coaster. It was quite. It took me quite a bit to adapt in the beginning, being that I was away from my family, being that I was in another country where I didn't know anybody yet. But it turned out to be the best decision I ever made in my life because it taught me so much about myself. It put me in a position where I had to learn so much about myself and really discover myself deeper than I could ever have imagined.
I've been enjoying those 7 years. It's been like really, like Dr. Melissa said, it's like a black hole. You know, it's been like a hard process, but the thing is, like, I've been working hard, and then I can't complain. I think free education, why complain?
It's been so many changes. It was such a culture shock when we got here the first time. And it's gotten better, it's gotten worse. The conditions have changed, especially after COVID. But in general, it's been a good experience. I met my wife here, so I'm super grateful. I met a lot of good people, good networks to work in other countries in the future, and overall, great experience.
What I was told, the medicine that I was told that I was going to be formed in, the values that I was told I was going to be formed in, it has been just that. It has been, how can I serve the people that are in front of me? How can I move mountains? How can I move whatever I need to move to serve? And sometimes understanding that sometimes you're not going to hear someone. Sometimes you're not going to have the answer, but you can always serve. Sometimes it's just, and it's happened to me, sometimes it's just listening to the family. Sometimes it's literally just standing beside the family, not just delivering bad news, but then standing by them, right? Sometimes it's having to deliver those hard news and answering questions as best you can with patience, repeating. So understanding that, and that's something that's very clear in the curriculum, and that's something that I know whether I'm in China, whether I'm in Zimbabwe, whether I'm in Colombia, that's a medicine that translates to any nation. That's a type of medicine, and I strongly believe that that's the type of medicine that they teach here, and that's the type of medicine that I was told I was going to be taught in here, and I believe that has stayed true all along, even with the difficulties, even with the hardships. Yeah.
I need to take my STEP exams, but in the future I will be Dr. Najee Day-Chavez, pediatrician, neonatologist.
So I hope to return to Harlem or a community like it, hopefully in New York City, and serve as best I can to bring the knowledge, the skills, and the humanity that was instilled in me in Cuba, and to use that as a tool in order to improve the health in our communities back home.
For now, I'm not going back to the state, so I'm staying here for the next 3 years in Cuba because I want to do pediatric, After I'm done, and then of course, I'm going back to the state, and I want to help my people in Guatemala. That's the goal for now.
A big part of also why I came to study here was because the schooling is in Spanish, and I was fluent in Spanish before conversational, but I wasn't able to attend to people in Spanish, so it's something that really helped me, especially trying to go back to the Los Angeles area where most people speak Spanish, and I could give back to those communities that I really want to serve, that I truly want to serve. So going back home, because I've been away for so long, and doing residency and working in the community.
I want to go into pediatrics, and I want to go either into pediatric cardiology or pediatric neonatology. I was thinking about ped meds, which is a joint residency program. But when I really sat down and reflected, I was most passionate about working with kids. Cubans have this saying that goes along the lines, el que mucho abarca poco aprieta, which is really, if you're trying to have a good grasp of a lot of things, it's a lot harder to hold it tighter. So I'd rather keep my net a bit narrower, but have a tight grip on it.
Ciencia y conciencia. La ciencia, it means rigor. Scientifically, because as doctors we have to be scientifically sound in order to provide the best care. But that in itself is nothing if it's not coupled with conciencia, which means that you treat patients with a high degree of integrity, a high level of care, empathy, because otherwise we are prone to, despite our scientific knowledge, to mistreat patients if we don't come at it with an angle of conscience.
To me, it's being aware of the mind, body, and the spirit, and treating not only just the enfermedad, but also the person and whatever emotional needs that they have, and being there not only as their doctor, but as a support.
Ciencia conciencia, it's for me, it's like to place myself like in other people's shoes. Like we have to be like, they're human, they're just like me. I have a need and you have a need, so that means I need to help them out. It's like my family. That's how I see now people.
That's something they always tell us here. We're doctores de ciencia y conciencia, so science and conscious, which is empathy, communication, really understanding the patient, trying to connect with them the best way we can to treat them. Another thing that they always repeat is the biopsychosocial model, so treating the patient as a whole, as a emotional, mental, physical health, which is something that they instill in us here that we want to take back to the U.S. when we practice medicine.
Ciencia con conciencia, what does that mean to me is that in the end of the day, you go to school and you labor to put forth a betterment of your community, not just for yourself. Understanding and mitigating the different folks that need services, that need help. There was a physician that came and he asked me, well, how are you going to find that underserved community in your country? And I'm like, that's not hard, because need everywhere. There's always needs. In any community, there's always needs. And finding that, I don't think it'll be hard. I'm not here because of myself. I think that self-made man, self-made woman, that's a fallacy, complete fallacy. We take a mother to come to this world. And in that same thread, I have so many people that have helped me, that will help me, that are still helping me. And as a physician, I think that that's one of the beautiful things that you do. You become part of that group that helps to build a community, to serve a community. You're not everything, but you're part of it. You're part of it. And you can, not just with the science that you know, not just prescribing medication, but sometimes, like my physician, my pediatrician did once for me, telling me about relationship advice, telling me about work ethic. So medicine does not just extend to the physiology, the pathophysiology, but you become a formal and an informal leader. You get to wear many hats and serve in many ways.
Beautifully.
Thank you to ELAM, thank you to El Comandante Fidel Castro Cruz for his vision, and we hope to carry that forward. Dr. Reverend Lucius Walker as well for making this possible, and we carry their legacy. And thank you to IFCO for continuing to administer this program. I'm just full of gratitude for so many people, but I have to start there, because without them, this wouldn't be possible at all.
So I'm grateful for this program because with this program, I will never be a doctor back in the state because I don't have family support. So that's why I'm grateful for this program, IFCO, Pathway for Peace.